Hi, my name is Caitlin Mahalik, and I'm applying for the MSN in Family Nurse Practitioner program at San Jose State University. At the end of 2019, I graduated from Holy Family University's Accelerated Second Degree BSN program in Philadelphia. I immediately started working in a neuro and medical ICU at UPMC in Pittsburgh, Pennsylvania. While here, I gained experience working with ischemic and hemorrhagic strokes, traumatic brain injuries, seizures, and neurosurgical patients. I assisted with bedside placement of external ventricular drains, or EVDs. As this was also a medical ICU, I also gained experience working with septic patients, GI bleeds, DKA, and frequent drug overdoses and withdrawal as we were an inner-city hospital. The COVID pandemic began while I was working there, which gave me experience working with incredibly sick COVID ARDS patients while also working with the stressors of low staffing and decreased access to supplies. At the beginning of 2021, I moved to California and began working at Kaiser San Francisco in their medical and cardiac ICU, where I currently work. I am also trained to float to our cardiovascular ICU for post-op cardiac surgical patients. The COVID pandemic was still ongoing at the time, so I was still working with incredibly sick COVID ARDS patients. This gave me a large amount of experience working with patients that were having many complications, often being in ICU for a couple months, and frequently dying, especially in situations where I had to support families who were not allowed in the room because of COVID and unable to be there as their family member passed away. So I'm very familiar with working with comfort care patients, providing medications for comfort, and providing emotional support to patients and families. I have also gained further experience working with a variety of conditions such as sepsis, diabetic complications, GI bleeds, pneumonia, drug overdoses and withdrawal, strokes, and pre- and post-op cardiac surgery patients, and I frequently work with patients in decompensated heart failure and cardiogenic shock. I am trained to work with Velitri and Remodulin administration in pulmonary hypertension patients. In our patients requiring dialysis, I'm not only trained in Tableau, a newer system for dialysis, but I am also a super user, so I'm able to orient nurses newer to the system. In addition to that, I am trained to perform CRRT, continuous renal replacement therapy, in patients that are too critically ill to withstand regular hemodialysis. And for our cardiac patients that require extra support, I'm trained on managing devices such as intra-aortic balloon pumps and Impellas. I am also on the rapid response team at Kaiser. In this position, I respond to any stroke alerts to quickly assess, obtain labs, and get the patient to CT scan within a 30-minute time frame in case we need to give a fibrinolytic like TNK. I also respond to all code blues throughout the hospital, helping manage a code until a physician arrives, making sure CPR has been started, they're attached to a defibrillator, pushing ACLS medications, and helping transfer the patient to ICU once stabilized. I'm a super user for the EasyIO kit to place intraosseous lines in emergency situations. In addition to responding to emergencies, I also perform rounds throughout the hospital monitoring for any patients that may be decompensating, help figure out a new plan of care, and providing guidance to med-surg nurses for anything they might find unfamiliar or just are uncomfortable with. I am also a unit representative for ICU's Unit Council, a committee with goals to improve ICU's practice, education, and staff morale. This has given me experience in being a unit leader, trying to advocate for evidence-based changes in our practice to better our nurses and patient care, and it's given me experience seeing things on the other side of what management needs to deal with, such as staffing, budgets, and bringing forth larger goals from upper leadership. I am also a preceptor for ICU. I orient staff and travel nurses that work for us and precept our nurse fellowship program where nurses from med-surg come in for a 4-month orientation as new to ICU. And then lastly, I work for interventional radiology in addition to ICU currently at Kaiser San Francisco starting last October 2024. This has given me experience working on the outpatient side as many of our patients come in just for a few hours for a procedure. My job is to prep these outpatients for their procedures by doing initial assessments, reviewing medications, doing education for their procedure. During the procedure, I help provide sedation and monitoring of the patient and assisting the physicians. And then afterwards, I help recover from sedation and monitor for any complications before they go home. I believe my experience makes me a good fit for this program as I have developed extensive experience with in-depth assessments, critical thinking skills, and skills in teaching, emotional support, and knowledge of how diseases progress. Thank you for taking the time to review my application and watch this video.